Edo State
Tonight, Edo State government expresses reluctance to have total shutdown over COVID-19, cautions against disobedience to experts' advice. Fumigation of markets commences across Edo State. Also, correspondent X-rays absurd practices and beliefs and experts' advice in the face of coronavirus infections. A very good evening to you and a warm welcome to the main news bulletin tonight. I am Agatha Egwaruju. The number of confirmed cases of COVID-19 still stands at 254 as at 6 o'clock this evening. This is following 16 new cases published yesterday at about 9:30 in the evening, which revealed that Lagos had 10 cases, the Federal Capital Territory 2, Oyo 2, 1 each in Delta and Katsina states. Discharged cases are 44 and 6 deaths. In a press briefing this evening, the Presidential Task Force on COVID-19 expressed appreciation to the families of all health workers on the front line and reiterates need for states to strengthen their response capacity. Now, Edo State government is to strictly enforce the guidelines which have been announced to stop the spread of COVID-19. Governor Godwin Obaseki gave this information in a broadcast this Wednesday, highlighting the new measures government is adopting in this regard. Ogochuka Ona monitored the broadcast and has an excerpt.
For the next 14 days, it is now compulsory that every person in Edo State must wear face masks while in public. The Edo State Association of Tailors and Fashion Designers are mass producing high-quality, reusable face masks at affordable prices. Any gathering of more than 20 people will be immediately dispersed and persons involved will be prosecuted. The government of Edo State will shut down any hotel found to be hosting guests who travel from outside the state and have not informed the COVID-19 response team to screen such guests. Vehicles with passengers not adhering to the social distancing regulations will be impounded and the driver will be prosecuted. All business premises and households must have hand-washing facilities at points of entry, and please insist that everyone must wash their hands before entry. All government hospitals and primary health care centers and designated private clinics will be used as screening centers to screen citizens who believe that they may have been exposed or suspect that they may have symptoms of COVID-19. Unfortunately, from the evidence we now have, the number of cases are likely to increase significantly in the next few weeks, unless we take very drastic actions now to slow down the spread. We have gathered information that large numbers of our citizens who traveled back home in the last several weeks from overseas may not have self-isolated themselves. Although majority of the current cases are individuals with travel history and those of their relatives, in the coming days, we are likely to see community transmission of the virus to people who do not have any travel history.
He says government is aware of the challenges faced by the people and will be distributing food items to the most vulnerable members of the society. In Benin, Ogochuka Ona.
Now it is day one of the fumigation of markets in the state. A former CAFO monitored the exercise as well as the relocation of traders on essential goods to designated school premises in Benin City.
Ikiosa was relocated to Ohuoba Primary School, acknowledged government's efforts at protecting them from contracting coronavirus. They expressed sadness that no provision was made in the area of shelter as they have to display their wares under the sun.
And pepper for where we sell for that side before for Ikiosa market. But then the people come primary school as me come, I don't even see I want to put anything.
Here na school now. Here na school. We no fit share for inside school.
On the allegation in some quarters that traders were asked to pay 5,000 naira fine at Ikiosa before they can access the schools, these traders say it is not true.
They don't collect any money from us. They don't collect any money from our hand. Just that this morning when we come here, so they say everybody to stay outside first. So they now market the ground for each person this morning. So after that, everybody go and shade our markets.
At the urban market, the fumigation exercise was seen going on.
Fumigation exercise going on, and here with me is the general manager, Edo State Synergy and Advertisement, to tell us how far they've gone.
This is the pilot project. Well, as I speak to you right now, we are working simultaneously in different markets around the state, and we're going to work in all the local government and the Trinidad district.
Surprisingly, unlike Ikiosa, Ogbe Primary School, where the urban market traders were relocated, was empty. As at 1 o'clock in the afternoon, when NTA crew got there, no trader was seen, though they have been allotted space. The situation was the same at Ogbe Primary School, where Inyanga Market moved to. Few traders and buyers were spotted looking all worried.
And you can see for yourself, the place is so empty, like we can't get anything. If they are going to shift market or do anything, everything should be done accordingly.
Meanwhile, New Benin Market that moved to Penn Primary School was a beehive of activities. However, with the crowd and closeness of people in the market, one begins to wonder if the physical distancing will be achieved. People are hopeful that the directives by the government will yield positive results as they look forward to going back to their markets. In Benin, Ifeoma Okafor, NTA News.
In the meantime, medical experts in the fight against coronavirus want the public to play its role in stopping the spread of the dreaded virus. This was the call made by the Director, Center for Disease Control, Edo State, Dr. Osa Bruce, and a health system strengthening consultant, the World Health Organization, WHO, Dr. Alphonsus Aigberemole, as guests on NTA's Current Affairs program, Midweek Connect. Ogochuka Ona reports.
Increasing significantly, experts are worried about the attitude of some citizens and want a departure from the usual practice.
Sorry to say, I'm on air. Many people, they are recalcitrant because you give a directive, they will not follow it. Like the transport, because before government came out with to tell them that persons, they should be carrying less persons in their vehicles, 2 per seat, then 1 in front. Government engaged their union, and all these things were explained to their union, and they were supposed to have gone back, sensitized. At least government came out with a policy, even when they even complained that it will be difficult for them to comply with because of the levies that are being charged. We passed the message back to government, and government in his own wisdom abolished the levies for this month. That would have been a very good incentive for them to comply.
The world itself is not doing enough. The world is not doing enough because the disease is beyond what we know and understand all the while. Okay, that's a major challenge. You can't separate culture. You can't separate attitude from disease epidemiology. For example, we were told that one of the reasons why the spread was very hasty in Italy is that they have this culture of greeting and hugging each other, putting face to face to kiss each other, and that's part of why it spread. So here too, the attitude of the people, which is part of our culture, is a challenge.
They also touched on so many other matters that are of importance in the campaign to contain the spread of COVID-19. Ogochuka Ona, NTA News.
And Dr. Alphonsus Agbiremole is here with me in the studio. I told you earlier he's a health system strengthening consultant with the World Health Organization. You're welcome, sir.
Thank you.
Okay, now let's start this way. What is this about Edo State entering the maximum stage of infection as regards a spread of COVID-19? We earlier heard from the governor talking about it in his broadcast earlier, that there are possible increase in the number of infections in the coming weeks.
Okay, the nature of the transmission and spread of the coronavirus is such that over here in Nigeria, we had the first set of cases that were imported from countries outside of Nigeria. And we could easily tell from those first few cases that these persons came from country A, B, and C. That was the scenario of imported cases. But then later on, we now had people who had direct contact with those initial imported cases. Those ones fall into the group we may call local transmission.
Okay.
Now, at a certain point, if you do not succeed in breaking the transmission at that stage, you have a situation wherein more persons in the community or in the state or in the nation like Nigeria will begin to get infected, and you cannot exactly trace those infections to particular persons, meaning that they may have been infected by exposure from multiple sources, by exposure by touching surfaces and not necessarily coming in contact with individuals. At that time, you can't link them to index cases. That's the stage where we say we now have community transmission, and that usually happens after a period about 3 to 4 weeks, like we have observed in many of those countries. And at that time, you may have figures jumping. You could move suddenly from 10 to 100 in a day, and then like we have seen in the US and Spain and Italy, jumping into thousands within a few weeks. And that's what I believe His Excellency, the Executive Governor, was referring to. And that's really the concern. The concern at that point is beyond the fact that the disease is deadly. It is that we do not want a situation where the spread overwhelms the health system, the capacity of healthcare workers, the capacity of health facilities to respond. I paint a simple scenario. If you have 100 cases of COVID-19, for example, in the States, and then you have like 200 or 300 bed spaces, and you assume that a large number of those 100 cases were admitted, and then suddenly within 2 weeks you now have 500 cases. The question is, where are the bed spaces? Where are the ventilators? Where are the trained healthcare professionals to attend to these conditions? So that's the concern here, and all measures need to be taken to ensure that we do not get into that stage. And even if we do get there, we would have been ready on all fronts.
Okay, I understand there is call for concern, but is there cause for alarm? What should people be doing differently at this point?
What people should be doing differently includes the fact that people need to adhere now more than ever to all the measures that have been publicized since the beginning of this pandemic, which includes the issue of social distancing, the issue surrounding self-isolation, and the issue surrounding early reporting. For example, the measure that the government is now considering that are taking effect from today, shutting down markets, were because people refuse to comply with the simple directive that we're given. Now we're talking about prosecution, we're talking about seizing people's goods, we're talking about impounding vehicles, because we want a situation where people are able to comply strictly now. Because if we don't do that, we may get to a situation where the problem might spiral out of control, and we'll have to do much more to be able to bring it back to under control.
Okay, now with the start of the fumigation of markets, I'm just wondering, will this add value to the fight against the spread? How will this stop spread of the virus from infected people to others?
It will add value. It will add value. The value is in the fact that the transmission of the virus, apart from occurring through droplets when people sneeze, they cough, or they talk, these droplets can also attach to surfaces. Benches in the market, door handles, and items around the market. So what the fumigation does is to provide an environmental solution by fumigating wherever the viruses may have be bound to surfaces they keep them off with those chemicals in the fumigation equipment.
Okay, now we are seeing a situation where it seems that people are not really adhering to government's directive or government's advice on social distancing. We could see them in the markets, the women in traders and buyers in the markets. To a large extent, they don't observe the social distancing measure. Now, can you throw more light, especially on gains when people observe this social distancing, especially as we have seen in developed countries?
Okay. Social distancing, for me, is the single most important non-therapeutic response to this pandemic. By that I mean, okay, there are experimentations here and there on medications that can treat. There are things like using face mask, and then using gloves, and then if you're a healthcare worker, using all of what makes up the personal protective equipment. But social distancing is something that everybody can practice. You do not require any special healthcare training. You don't need to be a doctor or a nurse to practice social distancing. What social distancing does is that it helps to break the chain of transmission. The droplets of the virus are able to move in the air to an extent of about 1 meter from the person who produced the droplet. Now, if you are able to stay apart from each other between 1.5 meters and 2 meters, those droplets cannot find their way into the nose or the eyes or the mouth of another person. Another aspect of social distancing we need to emphasize is the issue of self-isolation. Self-isolation is a part of social distancing. What does it mean? Whenever anybody suspects that he has been exposed to the COVID-19 infection, for example, those who came in from countries where there have been widespread transmission of COVID-19, or those who may have come in contact with people who ended up becoming cases of coronavirus, or people who may be exposed in their professional work, like healthcare workers. When you suspect that, you do not wait to start manifesting the symptoms before you isolate. What you're expected to do is that from that moment on and for a period of 14 days, you should avoid contact beyond that 1.5 meters to anybody, including your family members. People who came in from outside of the country, which we refer to as persons of interest. We've told them, all the ones who are able to reach and spread the news, and even in the media, that within that 40 days, stay away from your families. Talk to them, explain to them, be within a certain room in your apartment where you won't come in contact with your family. And that has really helped. So it's something that everybody can do. That is the good thing about social distancing. And during that period, watch out for the symptoms of fever, of dry cough, and of difficulty with breathing. The numbers are there everywhere. If you experience such a symptom, immediately put a call across. They will come and investigate and then help such a person out.
All right. Thank you so much, Dr. Alphonsus, for sharing your time with us.
Yeah, thank you very much.
You're still watching the Minis Bulletin on NTA Benin. We will take a short break now. When we return, we have more reports. Do stay tuned.
My people, make una listen o. No be news again say coronavirus don enter Nigeria. Coronavirus na that bad disease from China wey dey cause fever, dry cough, sneeze, pneumonia fit enter and e dey kill. But no cause for alarm because our government dey on top of the matter. Just shine your eyes, wash your hands with soap and tap wey dey run, cover your nose and mouth if you wan cough or sneeze. No enter bus wey pass 3 people per seat. Keep good distance from people. No near person too much. No shake anybody. No hug. Government don't even ban any gathering of more than 20 people. All shops for market closed except people where they sell food, medicine, provision, fuel and other essential things. If you see as your body be, quick go hospital or call 0808 4096 723 or 0806 425 8163. My people, make una no panic, no carry rumor. May Edo State government bring una this message.
Next time you visit the ancient city of Benin, 2 things will excite you: the warmth and welcome of its people, and of course, the class and style of its hospitality business. Randeki Gold, home of hospitality like no other, located in one of the most serene environments in the ancient city, truly classy and exquisite with world-class facilities. Fully equipped digital multipurpose hall with life-size, ultra-high definition LED screen, 180 square meters king-size swimming pool with bubble bath, enough to leave you breathless. The exotic Ariel's Bistro and Grill Restaurant with variety of continental dishes, especially some of the rarest delicacies you can find in town. Fact is, a visit will truly convince you that we are gold. Rendeki Gold is the gold wing of the prestigious Rendeki Royal Hotel at 6 Henry Street off Ihama and Boundary Roads, GRA Benin City. www.rendekihotels.com. Rendeki Gold. Our hospitality is gold.
Enjoy your service, woman.
Be nice. You're welcome. Please, where's the restroom?
Or just go into your right.
Thank you.
I follow.
Mommy.
But you see, it's nothing to worry about.
Now, Glow 4G, the wrong thing.
Data is oxygen. Glow 4G, the new speed of life. Your #1 4G network nationwide. The very best from Glow, the grandmasters of data.
Thank you for staying tuned. And still talking about the coronavirus pandemic, Edo State government has lauded the concerns of corporate bodies and public-spirited individuals and their support in meeting the needs of the people as the fight to check the spread of the virus continues. Secretary to the State Government, Usaudion Ogi, was speaking while receiving relief items from some corporate bodies. Goodluck Inaini reports from the Government House.
The items donated include pharmaceutical items, detergent, buckets, water, carbonated drinks, and cartons of noodles. The Secretary to the State Government, Usaudion Ogi, described their concern and efforts as a morale booster which will help sustain the state government's efforts in the fight against the disease, while urging public-spirited persons and Edo citizens to emulate the gesture. Mr. Ogi is hopeful that the state will overcome the dreaded disease.
As a government, we have a steering committee management. Everything that is given for this cause, we make sure that it gets to the people that require it. The committee is made up of religious leaders, traditional leaders, civil society. So we want to use churches, we want to use mosques, we want to use our community leaders, traditional leaders to get to our people. There's no politics in this. It is about our people.
The SSG urged citizens not to see COVID-19 as a death sentence, rather as a phase and must be over. In Benin, Goodluck Inaini, NTA News.
The news ends after this break. To stay on.
St. Regis Hotels and Resorts. Come have a taste of class and quality. Exclusive VIP suites and resorts in GRA Benin City. Experience paradise in comfort. Come live in your dream home of luxury. St. Regis Hotels and Resorts at number 7 Osaigede Street off Upper Adesua, GRA, Benin City. For reservations, call 08-1800 00956.
Now, since the inception of COVID-19 and the introduction of raft of interventions designed to contain the spread, such as social distancing and the shutdown of markets, while many Nigerians have continued to reach out to the vulnerable and other less privileged members of the society. One of the visible donors is former Secretary to Edo State Government, Pastor Sage Izeyamu. Ogochuka Ona reports.
COVID-19 pandemic has affected age-long conventional economic activities and disrupted income streams. However, in the face of these difficulties, there have been reports of humanitarian gesture all over the world, including that from the Red Cross Society of Nigeria, also in NTA, cushion the effect of the pandemic on livelihoods. These have been through donation of cash, food items, and protective kits. Among notable donors is former Secretary to Edo State Government, Pastor Sage Izeyamu, who has not only targeted orphans and those in dire need, but also to those offering essential services. He was in NTA on one of his rounds.
A lot of places have closed, but NTA has not closed. So even when we are at home, we are still able to watch live news about what is happening. And we know the risk that many of your staff are taking at the time when even medical personnel are warning all of us to stay indoors. So we want to appreciate you, we want to thank you. So we also thought that as we provide for others, we should also bring for those who are essential staff, those who are in the front line in this fight against coronavirus. And of course, when you look at medical personnel, you're also looking at media men, journalists, for the role they are playing.
This is an inspiration, opportunity for other well-meaning Edo people and Nigerians to know that there are people who are out there who feel, in spite of knowing the dangers of COVID-19, feel they have families to feed, they have to make a daily living, they have to make money to buy medication, to pay their rent, to buy food. So we just want to use this opportunity to call on other well-meaning Edo people to meet the needs of the downtrodden and the poor. For us here in NTA, we are very grateful for the gifts. I just want to promise that they are going to go down to the essential staff who are working, those at the bottom of the ladder.
Pastor Izeyamu also agrees with the zonal director and called on well-meaning individuals to help bring succor to the less privileged.
All we are doing is still not enough to cover the state. We're talking about just 4,000 in a state where you have over 3.5 million people. Coronavirus is something that is very serious, and I think it's something that should bring all of us together at a time like this. We are all dealing with a common enemy that has the potential of threatening the entire human race. The reality is that it's not only in Nigeria today, but it's even in Edo State.
The zonal director used the opportunity to highlight the major challenge on the field.
The major challenge that we have encountered during this enlightenment campaign that we have embarked upon is our respondents telling us they have to go out and work. They have to go out and work, particularly the daily paid laborers. So if we have interventions like this coming to meet their needs, and they know that they can get food, they can get basic necessities, sanitary provisions, and so they don't necessarily have to come out and risk their life and endanger other persons, because we have seen the very destructive nature of COVID-19.
However, residents are to continue to play their part by maintaining good personal hygiene and social distancing. In Benin, Ogochuka Ona, NTA News.
And that concludes our package tonight. Thank you for watching. Coronavirus is real. Wash your hands regularly and maintain physical distance. Good evening.
I close my eyes to prophesy upon 500 people. Wherever you are hearing the sound of my voice, the word. Become the word. The danger, Lord, that people will see, they will hide themselves. You will see that danger, the danger will run away from you. Turning point with Pastor